Can I go check a pulse?
No! Back up! Now!
I'm a physician!
I don't care.
We understand. We got EMS coming. I get it. Just give us a second.
We have medics on scene. We have our own medics.
Where are they? Where are they?
Where are they? Yeah. I don't care. Just gives me chills.
I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in healthcare and beyond.
So, here's the thing. As physicians, we take an oath to first do no harm, but that's exactly what happened here. Renée Nicole Good was a 37-year-old Minneapolis mother of 3. She was a U.S. citizen. She was not charged with any crime. She did not receive a verdict of a death sentence. But on January 7th, 2026, during a federal immigration enforcement operation in South Minneapolis, she was fatally shot by an ICE agent. Video from the scene shows multiple shots being fired into Renee Good's SUV as she was driving away and not endangering anyone. She was struck. Her vehicle then collided with a parked car and a pole. Minutes later, emergency responders arrived and found her with these multiple gunshot wounds. But what makes this case especially disturbing is not only the use of force, it's what happened after the shots were fired. So after she was shot, a bystander identified himself as a physician. He asked to check her pulse. He asked to render aid. ICE officers refused. They refused a doctor to provide medical care to a dying patient. They told him EMS was coming. And when he said he was a doctor, one officer reportedly responded, "I don't care." I mean, think about that, guys. As physicians, as humans, we know this truth in our bones. Every second matters. In the early 1980s, physician R. Adams Crowley introduced the concept of the golden hour or the critical hour. He taught us that there is a critical window, often less than 60 minutes, between life and death after severe injury. Rapid evaluation, immediate intervention, definitive trauma care, those steps save lives. That understanding is the foundation of modern emergency and trauma medicine. Those life-saving helicopters, dedicated trauma centers, this all accelerates the care within that golden critical hour. And that's why this next clip is so deeply disturbing. Let's roll it.
This morning I learned for the first time through an NPR story that Renee Good still had a pulse 8 minutes after she was shot by an ICE agent. And yet the offer to administer aid from a physician on the scene following his Hippocratic oath was denied.
So let's be absolutely clear about what this means, you guys. Renee Good had a pulse for 8 minutes. That's a long time. And she was alive in the crucial moments after being shot that she potentially could have been saved. And yet the medical care was delayed. Better yet, not delayed. It was actually denied by ICE agents. Not seconds, but minutes. And by a systemic decision, choices that were made in the name of what? Enforcement, rather than life-saving medical care. And so as a physician, as an orthopedic surgeon who's done trauma like Dr. Brown in ER bays, we know that minutes cost lives. That's not abstract. That's our reality. In trauma medicine, we talk about, again, this golden hour. It's a critical window after a severe injury has happened. You got to have early intervention. It dramatically increases the odds of survival. And so when we see every day in a trauma center uncontrollable bleeding, compromised airway, shock, or head injuries, we know that seconds and minutes matter, because if you delay that cost, that person's going to die. So someone's shot. And the initial steps are rapid assessment, the ABCs. You guys have all heard this in CPR training. Airway, breathing, circulation. You want to stabilize the airway, control the hemorrhaging. And then you need to transport that person to definitive care. That's the standard of what we've done in this country to save lives. But here's what's profound and disturbing, that a person that actually had a pulse, someone could have actually helped that person was denied to help what they do naturally on day to day, what they're trained to do, because enforcement officials overrode the professional medical intervention at the scene. Not because care wasn't needed, because it was, but because someone with a badge decided instead of a clinician, instead of a doctor, who knows, he may have been a surgeon. And so I want you guys to think about that. I mean, if that was you, if that was your mom, your child, this chaotic seconds of shooting a bystander who identified themselves as no threat to the officer that shot her, she was driving away. And then to have a physician who identified himself and he was willing to help. You know, we call it this Good Samaritan Act. But he was told no. Even when he said, I'm a physician, the officer responded, I don't care. What? So here we are. And from a clinical standpoint, that's not just maddening, it's antithetical to very purpose of emergency medicine and care. Medical training, emergency systems, trauma, protocols, they exist precisely because we know the timing, the intervention that saves lives. That's not my opinion. That's not Dr. Brown's opinion. That's evidence-based medicine and practice. Dr. Brown?
I mean, exactly, Dr. Sloan. This administration continues to deviate from evidence-based practice, whether it's vaccine schedules, reproductive care, and then now in the most critical moments of acute medical need. What we are witnessing, and most vividly in Minnesota, is not just a failure of law enforcement. It is a failure of basic public health judgment, where the presence and priorities of federal agents were placed above the immediate, life-preserving actions physicians are trained to take. This isn't a philosophical debate. This is medicine. Renee Good was a U.S. citizen, not that that should matter, a mother of 3, and she was killed in Minneapolis during this federal immigration enforcement sweep. She was shot multiple times. She was not convicted of any crime. She had a right to life-preserving care. And yet, instead of clinical judgment guiding the moments after she was struck, we saw enforcement priorities shape the scene. And this isn't abstract. It's human physiology and pathology colliding with policy and force. And in that collision, someone who should have been helped in that critical golden hour wasn't. And the consequences aren't abstract either. When law enforcement overrides medicine, it undermines trust in emergency systems everywhere. Right? When people call and believe that they're calling first responders or the clinicians are trying to help and they can be sidelined, the entire system breaks. It makes people hesitant to seek help. If calling for care might mean force shows up instead of compassion, people won't call. And it blurs the line between public safety and public harm. Medicine is supposed to be guided by evidence, not intimidation. And then it signals to Black and Brown communities and all vulnerable people that their lives are negotiable. Sadly, Black, Brown, and poor communities already know this truth, that their lives are treated as negotiable. And when clinical judgment is sidelined, it's not just policy that's broken, right? We're talking about trust, and that's the deeper injury of this all. And that matters profoundly, and not just clinically, but socially, ethically, historically. These ICE raids are being treated like someone else's problem, as if they only impact undocumented immigrants or people from Latinx communities. But let's be perfectly clear. This is not a problem just for Latin American-born immigrants. When enforcement operations go unchecked and are this aggressive, anyone who's Black or Brown or appears to be Black or Brown by the definition of whoever that ICE agent is, or anyone who lives in a community under heavy federal enforcement, they become vulnerable. Let's roll the next clip.
My name is Dr. Lisa Mattson, and I'm the current president of the Minnesota Medical Association, an organization that represents over 10,000 physicians in Minnesota. As president, I personally have been made aware of the presence of ICE agents in our hospitals. I had a report of a detainee in the ED with injuries inconsistent with accidents. I also had a report of a vulnerable adult who didn't have a caregiver with him to help him make important medical decisions. There are reports of ICE agents refusing to leave the room for private exams or while patients are getting bed baths. There are also reports of staff experiencing rude and harassing behavior from ICE agents.
This is the time for the sigh, Dr. Brown. Yeah. And the actions we've seen in Minnesota now underscore that point. Federal agents and officials have deployed thousands of agents that have described themselves as the largest ICE operation ever, otherwise known as Operation Metro Surge, under the banner of immigration enforcement. But the operation has been linked to shootings, arrests, and disruptions to everyday life and safety of community members. So ICE continues to operate outside the normal boundaries of accountability and oversight. Who's policing them? No one. So local officials in Minnesota have repeatedly expressed frustration that the state and local investigators can't access evidence, even as the FBI pushes to control the narrative and the inquiry. And this has real consequences on the front lines of medicine as well. So Dr. Lisa Matson, seen in the video, she's the president of the Minnesota Medical Association. It's a nonpartisan organization and has described the climate that she's seeing patients, whether they're under arrest or not. And so reportedly being denied basic human and constitutional rights during encounters with immigration enforcement. So these medical professionals have testified that ICE agents have shown up in clinical spaces and at scenes of injury in ways that interfere with patient care, raising the alarm among physicians, and also really chilling effect of the prompt medical intervention being interrupted. So this isn't hypothetical. We're living it right now. When enforcement officials override medical judgment at a scene, like blocking a physician from providing emergency aid, it sends a huge message that medical care can be subordinated to enforcement priorities. Medicine is no longer the gold standard, if you will. So the departure from long-standing public health practice and basic emergency medicine is now undermines their trust, not only in the law enforcement, but also the very systems that are designed to protect life. So yes, what's happening in Minnesota is not just an immigration issue anymore. This is a public health crisis, and we're calling it out. It's a breach of human rights. It's a wake-up call that federal agencies can override clinicians and doctors and surgeons in moments of life and death that impacts all of us, regardless of immigration status, your race, or your background. But doesn't just stop at immigration status, right? Let's roll this next clip.
Preventive care is always better and cheaper than waiting for an emergency to arise. We're also concerned about the indiscriminate detention of anyone with brown skin, including Native Americans, who are the only people among us who are not immigrants. A report by one of the local news agencies last week reported that only 5% of detainees in Minnesota have a history of violent crime. And in the worst of the worst, 7 of those people's only crime was a DUI.
Exactly. Communities, right? Communities that are native to the United States, because when you think about it, other than the Indigenous communities here, we are all immigrants. Just depends on when our family members got here, right? Well, they're under direct threat when enforcement operations operate without restraint, without accountability, and without regard for human life. So when armed authority is allowed to override medicine, no community is truly protected. What you saw is the inevitable consequence of a system that has lost its moral compass. When physicians are blocked from rendering aid, when patients are denied care while still alive. She was still alive for 8 minutes. When entire communities learn that calling for help may bring harm instead of healing, that's a fundamental violation of medical ethics and the law. So in the United States, actually during the Reagan administration, a law was passed to state that emergency medical care is not optional, right? Under EMTALA, the Emergency Medical Treatment and Labor Act, anyone who presents with an emergency medical situation, medical condition, has the right to be evaluated and stabilized. Not citizens only, not people with insurance, not people with the right paperwork. Even if the person is arrested, everyone, regardless of legal status, regardless of immigration status, regardless of who is standing at that scene with authority, EMTALA exists for moments exactly like this, to ensure that emergency care is governed by medical necessity, not discretion, and especially not the discretion of some ICE agent. It's governed by physiology, not politics, by the urgency to save a life, not the priorities of law enforcement. And when the principle is ignored, what's at stake isn't just that one patient, right? It's not just Renee Good. When enforcement replaces care, the very foundation of emergency medicine, which is saving a life, is compromised. And that isn't some abstract concept. It's a reality with consequences we're already seeing play out in Minnesota and beyond. Not public safety, it's public failure. And it's more than this tragedy in Minnesota. Dr. Sloan, what we are now staring directly at are the core principles of humanity. At the question of whether a society truly values life or whether fear and force will begin to replace care and compassion in moments of crisis. Because if we allow that to happen, we're normalizing a world where emergency medical judgment is overshadowed by ICE agents and enforcement priorities. And that makes all of us at risk, medically, socially, and morally, because we are all human beings. And as the poet Audre Lorde reminded us, quote, "I am not free while any woman is unfree, even when her shackles are very different than my own." And that truth actually applies here because none of us are free and none of us are safe when care, dignity, and humanity are conditional.
You're right, Dr. Brown. And it's about whether medical ethics still even mean anything in this country now. You know, it's about whether you believe that every life, without exception, deserves urgency and dignity and care. So we just want you guys to sit with this because it's been a hard week. And all of our feelings are all over the place, and the uncertainty of what's going on. You see in this strain right now that we have in this system that is definitely a flawed system. The erosion of humanity at this time in history, we're watching it unfold. So you see what happens when power is allowed to act without accountability, because healthcare should never depend on who's standing between you and if you need help. It depends on just one thing, that you deserve care. So as we close today, we want you guys to stay empowered. We know it's hard, but we want you to continue to have a voice because it does matter. Stay disruptive because we are AIA contributors to MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Stay strong, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.